Hello, everyone. My name is Yuz Yusof. I'm reporting for Room Now. I'm based at Leeds, United Kingdom, and I've been joining the ACR conference as a virtual delegate. Today is day 3 of the ACR, our last formal day. So today is absolutely jam-packed with contents, and I'm privileged to be joined by Dr. Marta Casal Moura from the Mayo Clinic, Rochester. Hi, Marta.
Hello. How are you?
I'm fine, thank you. How about you?
Good, good.
Yeah.
Thank you for having me on this interview.
Absolutely a pleasure having you, Marta. So today we'll be talking Dr. Moura's abstract number 1569. The title is Lung Involvement in VEXAS. As we all know, VEXAS took a center stage when this disease was introduced 2 years ago in ACR. So now, fast forward 2 years on, what have you learned? So, Marta, can you please summarize the background of your studies and your objectives?
So, again, thank you for having our study featured in Room Now. This is a great honor. So we essentially, we wanted to look to our cohort of VEXAS patients, and we wanted to try to understand the impact of the pulmonary manifestations. As we know, lung infiltrates is one of the features that was initially identified by the original New England Journal paper and the NIH group, and we wanted to better characterize that. So it's obviously challenging to look into these patients because these patients have been going through a lot of diagnostic procedures and a lot of diagnostic uncertainty, and along the years before the disease was identified. So then we looked back to initially to our 22 patient cohort, and we wanted to see how many of them had a CT scan, a lung CT scan that we could actually look into and understand what was the type of lung involvement in these patients. So interestingly, we noticed that most of the patients that had CT scans, they actually had some lung involvement that could be characterized, mainly parenchymal changes, ground glass opacities, and this is probably the main feature of lung involvement in VEXAS syndrome. Then also there are some pleural effusions, some organizing pneumonia, and consolidations, and strikingly, it's not as common to have bronchial stenosis or more features more similar to relapsive polychondritis, which would be something that we could actually think about. And so what is interesting is that these ground glass opacities, typically they respond to glucocorticoids, to high dose of glucocorticoids, but they not always with full resolution, even in because these patients relapse even under corticosteroids, like high doses, like 20 milligrams. So it's interesting that in terms of respiratory manifestations, this is never or hardly ever the main issue of these patients. They certainly have, many of them, dyspnea at some point. Some of them cough, but less. But if you don't do a CT scan, many of them will be missed because lung infiltrates are present in less than 60% of the patients in the X-ray. However, you have a higher prevalence, around 85% of parenchymal changes that can be detected on the CT scans. So, yeah.
Yeah, thank you. So one of the uniqueness of your study was because you look into the HRCT changes. Was any do you look into the pulmonary function test as well? And was any changes there at all?
Yes, we did. We did look into the pulmonary function test. We did look into lavage, alveolar lavage, and also we did look into biopsies. But obviously, these kind of procedures, they were done as needed for the diagnosis, or to clarify their original diagnosis. That and so not all the patients did these even pulmonary function tests. And so our findings on those are relatively unspecific. They are mainly restrictive, and they mainly show decreased DLCO. But again, it's a small sample. About, I think, in that, so in those 22, really not even half of them had pulmonary function tests. So we still don't know the extension or the degree of involvement of pulmonary involvement. We are actually now expanding our cohort and actually try to characterize this involvement better.
Yep. Yeah. Thank you so much. So I think that was about my last question, really. So in terms of future research in this unique population, what else are you planning for that?
Right. We really would like to understand to what treatment do lung manifestation or lung involvement, what kind of immunosuppressant do they answer to? Because these patients typically were exposed to many immunosuppressants, and apparently this neutrophilic alveolitis that appears to happen in the lung, and this autoinflammatory lung involvement, he's responsive to corticoids, but not completely. And so what we've been seeing is that some of these patients, actually, the ones that are actually more symptomatic, they actually respond to JAK inhibitors and to tocilizumab, or anti-IL-6, I should say. And this is actually very compatible with the cytokine profile that these patients show. So our next steps, our future perspectives on this work is actually to better characterize this type of response, and to, by increasing our cohort, also to better describe the lung involvement with the HRCT scans that we've been looking into at.
Yep. Thank you so much for your insights. I think that's brilliant. I think we learn more and more about this, disease, and I'm sure, there's more that we can see, at next year's conference. So I hope that you all enjoy our video summary of this research, and you can follow Room Now through YouTube, Twitter, and LinkedIn. And my Twitter handle is Yuz Yusof. Thank you.
Thank you.